is Carly Prince. I'm making this video to reflect on my undergraduate experience as an intern at the Washington Patient Safety Coalition. The Washington Patient Safety Coalition hosts an annual conference every May to bring together healthcare professionals, providers, patients, families, and caregivers who are passionate about improving patient safety, experiences, and outcomes. To enhance the material shared in the 2020 conference, we invited a few participants to share an experience with themselves or a family member who has experienced medical error within the healthcare system. By including these guest speakers who have personal, life-altering, and emotional experiences with medical error, we felt as if we were better able to connect conference attendees with people in the healthcare system in a more impactful and personal way. Oftentimes, it's too easy to evaluate success and failure through numbers and statistics, but the sharing of these personal experiences truly brings the focus on the whole person back into the healthcare system. This year, unfortunately, the conference was canceled due to the COVID-19 pandemic, and we were not able to invite these storytellers to participate in person. However, for this project, I had the goal to highlight these stories and intentions of bringing the human back into public health. I wanted to share these stories of families who were willing to share their stories to the WPSC network. So, instead of in-person workshops and storytelling as originally planned, I worked with these patient storytellers over the last 6 months to develop their stories into the final video that's included later on in this video. The 3 participants you will hear from have a range of stories. I hope these stories will bring you, as the viewer, awareness of this public health issue. And if you and your family have experienced medical errors as well, I hope these videos give you confidence to share your story and comfort knowing you're not alone, and that there are organizations that are dedicated towards reducing medical error.
Good morning, everyone. My name is Megan Holt, and I am a patient and family advisor for Seattle Children's Hospital. I am also a self-published author, motivational speaker, small business owner, and full-time law student. Today, I'm here for my daughter, Maddie, and to tell you just one of her incredible stories in her journey fighting for her life. In 2015, my daughter's condition, Zellweger syndrome, rapidly progressed and she developed intractable epilepsy. My daughter's seizures immediately became life-threatening. The real story begins when we were admitted to the hospital after a week of consistent, prolonged seizures. One afternoon, Madeline began having a seizure, and her providers had ordered a rapid response team to be called anytime she had one. After assisting Maddie onto her side and with one hand still on her back, I leaned over her bed to push the call button. The nurse and doctor came rushing in and immediately called an RRT when they entered the room. 5 minutes passed and she was still seizing. By this time, the PICU, or Pediatric Intensive Care Unit attending, had come downstairs and was getting ready to order her seizure rescue medication to try and stop or calm the seizure. I could tell by the quizzical look on his face that something was wrong. In a somber voice, he turned to me and said, "Megan, we're going to need to call code blue. Madeline is breathing okay right now, but unfortunately we do not have any of her seizure rescue medication in the hospital due to a shortage. We are working with the pharmacy to find a compatible medication." In this moment, I could do nothing but hold my girl's hand, while she continued to convulse out of control and whispered in her ear, "Just breathe, baby." The code blue was called, and a flurry of staff from various departments began entering the room. At this point, Madeline had been seizing for 25 minutes. The PICU senior resident's phone rang. After a few moments of stark silence, he turned to me. "We think we have found a comparable drug. There is no guarantee, but we are hopeful it will work." As he was finishing his sentence, I could hear the flutter of nurse footsteps running down the hall, and a winded nurse had the medication in her hand. After administering the medication to my daughter, the seizure stopped within 2 minutes, and my daughter was transferred to the PICU for observation. If only they had the proper medication in the hospital, then this may have never happened. If only someone had checked with the pharmacy before she had a seizure event, then we may not have needed to call a code blue. In this situation, the what ifs that arose from this event were truly overwhelming. What if the medication didn't work? What if she had an adverse reaction? And worst of all, what if this had been another child? Would they have done as well? I am happy to say that the new medication not only worked, but it worked better than the prior medication, and what started out as a medical error turned into a medication discovery for little Maddie. Since this event, I have watched our hospital, with the help of myself and fellow patient and family advisors, update their seizure rescue plan for inpatient families. Now, upon admission, a child with a history of seizures has their seizure rescue medication ordered immediately and placed in a locking medication cupboard inside of their patient room. This story serves as a reminder of the immense impact, both positive and negative, that a medical error has on the hospital. In the words of the late Helen Keller, making a mistake is falling down. Failure is not getting back up again. Never stop getting back up. Maddie and I want to thank all of you for watching our video. Despite not being able to get together for the safety conference due to the COVID-19 pandemic, we support all of you, and we hope this story impacts the lives of future patients, doctors, providers, nurses, and anyone else who comes in contact with the healthcare system.
My name is Rosemary Waka. My youngest daughter, Luella, was born medically complex and diagnosed with Hardikar syndrome at 3 years old. Hardikar syndrome is rare. There are only 5 known cases worldwide. Luella's care team includes urology, nephrology, GI, cardiology, craniofacial, ophthalmology, and many more. Her complicated case has led her to be a part of RPM clinic and general surgery schedules. She underwent over 30 surgeries in her first 3 years, and there are many more to come. As you can imagine, all of the surgeries and hospital stays increase opportunities for medical errors. During a routine clinic visit, the ultrasound tech and I noticed an unidentified image in my daughter's left kidney. It looked like a bright white worm. We assumed it to be a foreign object. When I approached each department of her care team with my concerns and presented imaging, none were willing to grasp that there could be anything in her kidney. They unanimously confirmed that they had accounted for all tools used in their surgeries, and there was no explanation as to how something foreign could have been in her kidneys. Over a year and several bouts of urosepsis and repetitive UTIs later, I requested that the urologist amuse my interest and do a full scope into the kidney when she had her next surgery. The doctor agreed to investigate. He returned from surgery triumphant. He had found a string. My suspicions were validated. He said it was not from urology. He deduced it had broken off unwittingly from the IR nephrostomy placements. It was a piece off of a damaged instrument. The doctors were unaware that the string was broken. They believed all of their items were accounted for after the placement in Luella's kidney. If only the ultrasound tech's perspective was given credit, then Luella's chronic infections and sepsis could have been avoided. If only the tools used were more thoroughly examined post-use, then a defect would have been detected and rectified. If only the doctors had listened without defense, believed they could have left behind a foreign object, and not just brushed aside the bright image to be a fold in the tissue, then they could have empowered us in the care of our child and avoided further harm to Luella. I want to share this story because it is important to know that we're not alone in our experience. we have a voice. As my child's advocate, I aim to encourage patients and families to speak up. Our ideas, our perspectives, and our curiosities are valuable. Our voices will shape the future of our healthcare providers. I hope to inspire our healthcare providers to become more skilled than their mentors. It is our job as a community to train our providers and help them to grow and mature. Ultimately, the goal is to mentor each generation of healthcare providers to become better than the previous. I hope providers will learn to listen and not feel challenged when given ideas that seem impossible or even silly. I hope they gain understanding through interactions and experiences with patients that is greater than book knowledge. I hope that providers will be humble enough to accept that there can be medical mistakes, brave enough to seek impossible discoveries, and willing, even eager, to rectify error with the understanding that greatness can be achieved in recognizing failure while striving towards excellence.
Joy Christensen. This medical error story is about my mother, Daisy, who was 81 years old when this started. She has osteoporosis. Since diagnosed, Daisy was getting annual injection of Reclast during her annual physical exams at her primary care doctor's office. The claim is processed through Medicare insurance, therefore she pays for prescription co-insurance. In 2016, her primary care doctor changed. She went to her annual exam as usual, seeing the new primary care doctor. But instead of getting the Reclast injection during her annual exam, she got a prescription for Reclast. She was told to buy the medicine at her pharmacy, then make an appointment for the doctor to inject Reclast. Instead of questioning this new process with the new primary care doctor, she simply did as she was told. At the pharmacy, Daisy was shocked at the higher price of Reclast versus the co-insurance she previously would pay. However, because she needs it, she paid and made the doctor appointment. Later, she told her doctor she could not afford buying the Reclast. The doctor did not question further her comment, nor offered alternative options, such as the previous method of the doctor's office providing the Reclast then billing Medicare. Between the last injection in 2016 and 2019 December, Daisy did not receive any medication for her osteoporosis, nor was there any discussion about it or treatments during her annual exams. In 2018 December, Daisy found out she had breast cancer. In 2019 February, she had mastectomy. My sister and I cared for my mother as she underwent recovery, chemotherapy, and radiation treatments, with me becoming her full-time health advocate. At her annual exam in 2019 December, Daisy's primary care doctor noticed that her osteoporosis had been neglected and worsened. Even after a bone density test during her cancer treatment, there was no follow-up. After investigating, I discovered the broken process, billing mistakes, follow-up failures, and lack of coordination between various doctors' offices. Finally, the resolution. In 2020 January, Daisy got a Prolia injection, the generic version of Reclast, in her doctor's office. She is now back to her scheduled annual appointment for this. If only during the handoff between the original and new primary care doctor, they continued the process of the Reclast injection during her annual exam, then she would not have gone 3 years without the medication. If only the primary care doctor and oncologists had practiced better coordination and shared decision-making about treatments. If only, even when healthcare professionals are good, but they do not continue to self-monitor or be more diligent with the details, those details do cost patients the difference of better quality health outcomes. Thank you.
hear the statistic that 250,000 deaths a year are due to medical error, I hope we remember that each person included in that number has a story, and I hope we use that reminder as a driving point for change. Michelle Obama, in her documentary Becoming, says, "We focus too much on stats than stories. What makes you more than a statistic is when you see yourself as more than a statistic. See the power of your story and own that." Thank you for listening to these stories. I'm so thankful for the transparency of these storytellers, as well as their willingness to work with us through the unprecedented times that interrupted our normal conference planning. Thank you to my supervisors, Kinsey and Steve, for teaching me, encouraging me, and bringing me into this opportunity.